Coronavirus. Facts, not fear, starts now.
Good evening and thank you for joining us. I'm Shannon Heggie at WPRI 12 in Providence, Rhode Island. Today, the White House gave sobering news that up to 240,000 Americans could die from the coronavirus. The White House is also actively discussing recommendations that Americans wear face masks, but emphasizes that the first priority for face masks are medical personnel on the front lines. President Trump confirmed reports that the national stockpile is nearly depleted of personal protection equipment. He says that's because it is shipping directly to hospitals.
We're shipping things right in. We have, as you know, almost 10,000 ventilators, which we need for flexibility. Nobody's ever seen anything like this, where large groups of people, all of a sudden, just by being in the presence of somebody, have it. The flu has never been like that, and flu is contagious, but nothing like we've ever seen here. Also, the violence of it, if it hits the right person, and you know what those stats are, if it hits the right person, that person's in deep trouble.
The president also says he has had discussions with the Secretary of Veterans Affairs about possibly opening the doors of some VA hospitals to treat patients infected with COVID-19. Meantime, just days after President Trump signed a $2 trillion economic stimulus package in response to the coronavirus outbreak, Congress is now on to the next phase. Washington correspondent Joe Khalil has more.
Speaker Nancy Pelosi says the next coronavirus bill will focus on modernizing America's infrastructure.
We're very, very pleased with the aspects that we put forth today.
Pelosi says Phase 4 should fund improvements to broadband internet, access to clean water, health centers, and America's bridges and roads.
We couldn't get everything we wanted in the other bill. Let's begin to go down this path.
The president says he wants to avoid some of the speaker's Green New Deal spending, but he's on board with a big infrastructure bill.
And I'm suggesting $2 trillion. We redo our roads, our highways, our bridges. We fix up our tunnels.
And while some Republicans are hesitant about the price tag, not so President Trump.
Wouldn't this be a great time to borrow money at zero interest rate and really build our infrastructure like we can do it?
Many California lawmakers say they already have their eyes on specific infrastructure projects, and they support using Phase 4 dollars to get them done.
Look, I welcome the president talking about wanting to do infrastructure.
Congressman Eric Swalwell says he'd recommend funding for road and rail projects to better connect northern and central California.
We're trying to work on that project and dollars for that to put people to work to come out of this economy.
With Congress out of session and sheltering in place like the rest of us, Speaker Pelosi says it'll likely be mid-April before Congress can begin serious face-to-face negotiations. In Washington, I'm Joe Khalil.
Thank you, Joe. And now some sad news out of North Carolina, where a deputy has died of COVID-19. Let's go live now to CBS 17's Angela Taylor in Raleigh for more. Angela?
Shannon, you're right. You know, we now have 10 deaths from COVID-19, and sadly, as you just mentioned, one of those was a sheriff's deputy with Montgomery County. The sheriff's office says he was known around the community as Officer Bud. He was a school resource officer and a 14-year veteran of the sheriff's office. Officer Bud leaves behind a wife and 5 kids. He was 43 years old. Now, it's because of this death that officials are urging people to listen to the stay-at-home order and to social distance. But not everyone is listening. Our Colleen Quigley found out if you don't heed the warning, you could end up in jail.
It's the new normal, empty city streets, and social distancing is the way everyone is being asked to stop the spread of coronavirus. But Raleigh Mayor Marion Baldwin says not everyone is heeding the warnings.
I've heard reports of people out, in our parks playing basketball and whatnot. Not a good idea. And we're just asking everybody, young, old, whatnot, stay at home.
CBS 17 saw several teens playing lacrosse Tuesday afternoon, one day after Governor Cooper's statewide stay-at-home order went into effect, banning gatherings of 10 or more people and only allowing travel for essential tasks.
What is your message to people who don't seem to be taking it seriously?
All the research indicates you need to distance from each other. That's, if you get too close, that's how the virus spreads.
According to Wake County District Attorney Lauren Freeman, violating that stay-at-home order is a Class 2 misdemeanor and can land you a $1,000 fine or up to 60 days behind bars. But Raleigh police says if officers are called to a reported gathering, officers' primary objective will be to, quote, remind the public of the governor's executive orders with the goal of keeping everyone safe and with the expectation that they will immediately cooperate and comply. Enforcement will be a last resort.
They are not going to arrest people, for playing a game, but they are going to ask them to comply.
Yeah, so our local police departments are saying if you see a large gathering to just go ahead and call the non-emergency line so they can go speak to those groups. Well, tonight the curfew in the city of Fayetteville went into effect. It started at 9 o'clock just a few minutes ago, goes through 6 a.m. City leaders say the curfew won't impact essential travel like people going to or from work or anyone leaving their homes due to safety reasons. The mayor says the curfew is needed because of the sharp increase in coronavirus cases and people not following that stay-at-home mandated order. Now, a woman is going above and beyond in one of our cities to make sure that people are washing their hands. Stacy Buckner created a mobile hand washing station. She drives around the city of Fayetteville providing hot water for hand washing and even showers for the homeless veterans.
Our end goal is to get these men and women in permanent housing, but right now we just want to let them know they're loved and they don't need to be scared. And we're going to provide them with facts instead of fear, and hopefully we're all going to get through this.
Stacy's a true hero. She's calling on Fayetteville city leaders to help out by providing more hand washing stations around the city. And here is some great news for our kids. Sheetz Convenience Stores is launching a new program called Kids Meal Bags to help provide meals to families in need. Families, all they have to do is bring their kid to a number of Sheetz locations. They get a free turkey sandwich, chips, and a drink. This program officially starts tomorrow. And finally, we have some encouraging news. Doctors with Wake Med hospitals here in North Carolina said that the majority of people that are coming in being tested for COVID-19, 95% of them are actually testing negative. Will this trend continue? We'll have to wait and see, but that is some promising news there, Shannon.
Yeah, absolutely. Gotta hope so. Thanks, Angela. Unfortunately, we have some more tragic news, this time out of Connecticut. Governor Ned Lamont announcing a newborn baby died, apparently from coronavirus, becoming one of the youngest known victims. Officials say the baby, who was less than 7 weeks old, arrived at the hospital unresponsive and tested positive for COVID-19 postmortem.
But we have a tragic milestone in Connecticut. Probably the youngest person ever to die of COVID has died here in Connecticut. That baby was less than 7 weeks old. And it just is a reminder that nobody is safe with this virus.
Connecticut now has more than 3,500 confirmed cases of the coronavirus, with about 85 deaths. First responders like police officers and firefighters are some of the few who can't work from home during the coronavirus pandemic. Fox 4's Lauren Halifax is live in Kansas City now with more on one police department feeling the impacts of the virus. Lauren?
Shannon, good evening. After 2 Kansas City police members tested positive for COVID-19, 16 other police employees are now in quarantine. Police say they're now implementing procedures, canceling vacations, time off, shifting traffic officers to do patrol duties, all to make sure that any calls that come in for help continue to get a prompt response.
We have all the provisions in place to still respond to calls for service as people call. That's what we'll continue to do. So that's basically where we are right now, is ensuring that we have response to calls for service.
The Kansas City Fraternal Order of Police, the union, says that those 2 officers are just the beginning of what may be many more cops getting infected. Up until now, the union said officers have been getting masks made in Russia or the Ukraine. The KCPD spent $20,000 in just the last 2 weeks buying additional safety supplies whenever it can find those available. Now, 50 million Americans have an autoimmune disease. There are more than 200 different kinds of autoimmune diseases, and depending on what kind you have, the threat of COVID-19 could be more serious. Shannon O'Brien reports.
I am one of 50 million Americans in a club nobody wants to belong to. I have an autoimmune disease. There are 200 different types of autoimmune diseases, and depending upon which kind you have, COVID-19 could be more serious.
The problem with COVID-19, with this coronavirus, is that none of us have been exposed to it before.
When the body senses an outside danger has entered it, the immune system attacks it. In people with autoimmune disease, it also attacks healthy tissue.
People that have autoimmune diseases may not respond as a person without such a condition.
The treatment for some autoimmune diseases like rheumatoid arthritis and Crohn's disease is immunosuppressant drugs to stop the attack. Those people may be at greater risk of developing COVID-19 and more severely.
It's possible that they could be in that group that is at much higher risk to develop the pneumonia and the pneumonitis that we see that requires people to go to the hospital.
Dr. Jane Murray specializes in integrative and functional medicine. She says folks on immunosuppressing drugs should absolutely stay home. The prognosis for people with other types of autoimmune diseases is not quite as bleak.
I think you're in an intermediate category. Really be aware of good hand hygiene, and I'm now convinced after some things that I've been reading about wearing masks, even if you don't feel sick, is really important.
Besides following good hygiene and social distancing rules, Dr. Murray says the immune system works best when the cells are well supported, which means a healthy diet, lots of liquids, and plenty of sleep could help give everyone a fighting chance.
It's not like we're helpless. It's not like something just attacked us and we can't do anything. We can prevent it. And if we do not feel well, even if we don't have any kind of underlying immune condition, don't go anywhere. Don't expose anybody. Stay home. Really be serious about this.
Experts warn that people on immunosuppressive drugs may not get a fever, so you need to pay attention to the other symptoms of COVID-19, such as dry cough, tiredness, and trouble breathing. Do not stop taking any medications without first talking to your doctor. Shannon O'Brien, Fox 4 News.
In Kansas City, I'm Lauren Halifax. Now back to you, Shannon, in Providence.
Thank you, Lauren. And here in Rhode Island, the Department of Health reports 77 new cases and 2 more deaths. That brings the state's total to 566 cases and 10 dead. There's also 1 more Rhode Islander hospitalized today, bringing the total in the hospital to 60. Meantime, the city of Warwick confirms several COVID-19 patients are being housed at the Wyndham Hotel. They say they're taking steps to ensure the health and safety of everyone involved. And in her daily news conference, Governor Gina Raimondo said the state of Rhode Island has secured a $150 million line of credit to help with its cash flow. She's also promising new help for struggling small businesses. WPRI 12 reporter Kim Kalunian has more.
Well, today marks 32 days since the first reported case of coronavirus here in Rhode Island. And today the governor took some time to talk about how the state is responding and just how much has changed since March 1st.
Governor Gina Raimondo says teams of people are focused daily on completing essential coronavirus-related tasks, including acquiring hard-to-find personal protective equipment.
Today, right now, we have on the way to Rhode Island over 5 million N95 masks, over 3 million surgical masks, hundreds of thousands of gloves, hundreds of thousands of gowns.
The state is also working with researchers across the country and the CDC to assess what's next, assembling a model that might be ready by next week.
It will be a steep increase. I'm going to be reporting numbers that it's not going to make anyone comfortable. Exactly when the surge happens, what the peak looks like, when the peak comes, I don't know right now. We have estimates, but we are working it, and we're going to refine it every day.
Raimondo says by Thursday, the state will have the capacity to test 1,000 people a day. And while the number of cases and deaths continues to climb, the Department of Health is not yet ready to provide a hard number of those who have made full recoveries.
The vast majority of people with COVID-19 do get better, so 85 to 90% recover, rather uneventfully. It's a mild illness. It's so mild, quite frankly, that some people don't even know they have it.
Medical Director Dr. James McDonald says 33 COVID-19 patients have been discharged from the hospital since the outbreak began.
We are keeping track of it, though, but we just haven't been talking about it. We're focusing on what we think right now is most important, is identifying the cases, doing the contact tracing, and then getting the appropriate people into quarantine.
And today, the governor also offering some assistance to some of the groups that have been hardest hit at this time, including small businesses with fewer than 10 employees. They can now apply for some short-term bridge loans for some financial assistance. She's also offering meal delivery services. So if you're stuck inside of the house due to a quarantine or another reason, you can go to the website ridelivers.com or call 211 for more information on that program. We do have more information on both of these things on our website right now at WPRI.com. At the State House, I'm Kim Kalunian, Eyewitness News.
Thank you, Kim. And with social distancing in full swing, people are coming up with creative ways to visit loved ones in isolation. That includes one man in Ohio who used a bucket truck to visit his mother. He generally takes her out to eat twice a week, but hasn't been able to see her because of restrictions prompted by the pandemic. So he improvised, extending the truck's boom to the height of the 3rd floor of his mother's assisted living home. He then called her and told her to come look out the window. He said he checked with the home first, and they loved the idea. And this year's Wimbledon tennis tournament has been canceled due to the coronavirus. The grass court Grand Slam was set to start on June 29th, but a decision was made today to cancel the event. It's the first time Wimbledon has been called off since World War II. The French Open, due to start in May, has already been pushed back until September. All professional tennis has been suspended until further notice. Meantime, the NFL says it isn't planning for any delays due to the coronavirus, at least not yet. During a conference call, league officials announced the season will start in September and teams will play their full 16-game schedule. The plan is to have fans at the games. Now, the NFL hasn't been completely unaffected, though. Teams are engaged in virtual workouts this offseason. An inmate at a jail in Denver tests positive for the coronavirus. Let's go live to Aristea Brady from KDVR in Denver with more on who else could have been exposed. Aristea?
The city of Denver doesn't want to confirm how many deputies were exposed to the inmate who tested positive, but one deputy tells us it was up to 16, and yet the city doesn't want to test any of those deputies unless they show symptoms. We're not identifying the inmate other than to say he was arrested Sunday for misdemeanor harassment. You worked around him closely?
Yes.
We've agreed to protect the identity of the sheriff deputy who says the inmate was placed into isolation at first because he told an intake nurse he'd been having symptoms.
Then he turned around and told the nurse that he was lying about it because he was upset that he was in jail.
So, hours later, he says a different nurse and the charge nurse allowed the inmate into the general population. The deputy admits the inmate was not showing any symptoms at the time, but says by morning, the man was complaining of chest pains. He was taken to Denver Health, where he tested positive. So how nervous now are you that you may have been exposed and may be exposing your loved ones and your coworkers?
Very nervous.
Do you feel like that nurse made a mistake in taking him off protocol?
Oh, I mean, yeah, looking at it now, absolutely.
The sheriff's department says 2 other inmates are now in quarantine as a result of their exposure. But the deputy says no additional precautions have been taken for the deputies, 16, he believes, who came into contact with a COVID-19 inmate.
Nobody actually had any protective equipment on. We're working with this guy and getting him through this process. Everybody at this point becomes afraid. You know, we're afraid to take it to our families, our parents.
The deputy wants to be tested, but says the city tells him he doesn't qualify. His exposure was low risk.
I don't think any of the staff that was exposed should be going back to work, period.
So what's your decision? Are you going to go back or not?
I have to. Will I wear a mask all night long? Absolutely, I will.
The deputy says because of a mask shortage, they're only supposed to wear them around inmates in quarantine. He says the reality is the city needs to test every inmate who comes in. But you're dealing with an entire population where you just may not know until after the fact. How nervous does that make you?
It scares you to death.
As for the inmate who tested positive on Monday, deputies tell us he was released last night on a personal recognizance bond back into the community where nobody knows if he's self-isolating or not. Rob Lowe, Fox 31.
Thank you, Rob. And states across the country are closing schools for the rest of the year, and California is now added to that list. For more on things going on out west, let's go live now to Samantha Cortese and Andy Reesmeyer, I should say, joining us from KTLA in Los Angeles.
Thank you. Yeah, we'll get to that in just a minute. But confirmed COVID-19 cases in California have neared 10,000 today, with 200 people have died. In LA County alone, more than 1,000 people have been diagnosed with COVID-19 in the past 48 hours alone. 5,400 cases have been reported in Washington as communities race to stop the spread of the virus. But first, California is joining many others in the world recommending people wear masks.
We are now recommending that Angelenos use homemade face coverings when they are in public and interacting with others.
LA Mayor's Eric Garcetti echoed recommendations from the state health officials who say masks could be helpful in preventing people who are asymptomatic from spreading the disease. And you may remember there was a big controversy about wearing masks for so long. They're now going back on that, saying you should probably protect your mouth to stop the spread of droplets.
Yes.
They've been saying. They say homemade masks or just a simple cotton mask is effective, a bandana, something that just protects your nose and mouth. Is urging the public, by the way, to leave those N95 masks for medical professionals. Still practice social distancing. And when you're wearing a mask or something touching your face, don't touch your face while you're moving it around. Still practice good hygiene there.
Super frustrating, though. In the San Francisco Bay Area, the shelter-in-place order has been expanded and extended now to May 3rd. It was originally set to expire in April. It includes 6 counties in the Bay. Also, new restrictions have been placed on essential businesses like grocery stores and restaurants. They will all need to develop their own social distancing plans. They also will introduce a per-person limit on items that people have been hoarding. You might have already seen 6 feet apart markings on the floor to help customers keep a safe distance. That is official now, and no reusable bags. San Francisco was the first major metropolitan area in the nation to enact such safer at home and shelter in place orders. Many of those policies are now being implemented across the country.
This is a wild story. A train operator has been arrested near Los Angeles, accused of intentionally running a train off the tracks near the USNS Mercy hospital ship. Officials say Eduardo Moreno admitted in multiple interviews he crashed the train on purpose. He told the FBI he did it out of the desire to wake people up and did not believe the ship is what they say it's for. Moreno crashed through a series of barriers before coming to rest 250 yards from Mercy. No one was hurt.
And in Washington state, the governor has called on the National Guard to help protect and stop the spread of COVID-19 in communities there. The governor tweeted that the National Guard will be deployed to help in communities across the state to keep critical food banks stocked and also operational. He says they will help process, package, and distribute meals, and that they are not there to be law enforcement.
A Washington state dentist has been arrested, accused of using medical masks and gowns as kindling to try to burn his office down. 54-year-old Mohammed Matt Rafi was arrested and charged with first-degree arson last week. Several boxes of protective masks and gowns were burned, and arson investigators say they have ample evidence the fires were set intentionally. The man's also suspected of arson at this office 3 years ago. Personal protective equipment, PPE, of course, is in high demand as the health system deals with COVID-19.
And schools in Los Angeles and across the state will now be closed for the remainder of the academic year. That is according to the governor, but also Gavin Newsom, who says online classes will remain in session, but also the LAUSD. They are struggling to transition more than 67,000 K through 12 students to online learning and 75,000 employees to support them remotely. The district is spending roughly $100 million to provide internet service and digital devices for those students who need one.
Do you have any kids, family, friends, any teenagers looking to apply for UC schools this year? Listen to this. The University of California says it will ease admission requirements for fall 2020 amid COVID-19 pandemic. The UC system says it will eliminate SAT test scores and minimum grades. UC officials are calling for flexibility because many classes were shifted online and SAT dates are being canceled or postponed. More than 200,000 prospective freshmen and transfer students apply to the UC system's 9 campuses every year.
And finally tonight, Hawaii is taking a strong stance against people who are suspected of violating the self-quarantine orders in that state. Under a proclamation signed yesterday, residents and visitors who travel between islands must self-quarantine for 2 weeks or face up to $5,000 in fines. Those under quarantine cannot leave their hotel rooms or receive visitors. Social distancing requirements also stand for anybody leaving for medical care. Violators of the new quarantine rules could also be sentenced to prison time if convicted. That is the latest from KTLA out here on the West Coast. Back to you.
Samantha and Andy, thank you. Now, a quick reminder of the symptoms of coronavirus. The primary symptoms are fever, cough, and shortness of breath. The CDC says call your doctor before going to a clinic or hospital to be tested. And if you feel sick, please stay home. The goal of our Nexstar family is to make sure you continue to get the latest facts on the coronavirus without the fear. We'll be back at the same time tomorrow night with stories from across the country. For now, I'm Shannon Heggie. Thank you for joining us. Please stay healthy and enjoy a good night.